there's a lot of interest in looking at sin taxes for tobacco, alcohol, sugary beverages, because simply it helps reduce the harm from consumption, and at the same time, because those products are addictive, helps us raise revenue. And the idea is that because these are risk factors for health conditions such as NCDs, we should have a portion of those funds allocated to health. The challenge has always been, from a Ministry of Finance perspective, that they believe, first of all, these taxes, if they were earmarked, would be inflexible, and that the Ministry of Finance doesn't just deal with the Ministry of Health, but deals with many other sectors that also contribute to health, such as agriculture, such as water, and these are all known to be social determinants of disease. So finance likes to have flexibility. However, we also believe that there are two concepts here. You could have what we call soft earmarking and hard earmarking. Hard earmarking would be where you take the entire revenue and allocate it, let's say, to one sector like health, or you could actually apportion it. And I think soft earmarking may be something that Ministries of Health and other sectors can collaborate to go and make a case to the Ministries of Finance. I think it's crucial now as we move into the era of domestic revenue mobilization. The reduction in aid in 2025 was one of the largest ever recorded, in fact, the largest ever recorded in history. So these are examples of some innovative taxes people are looking at. You could have other broad-based taxes on mobile money, betting, airlines, extractive industries, but the same sort of principle aligns. At the end of the day, we must balance that out with the macroeconomic issues that the Ministry of Finance is dealing with, but also deal with some of the financial requirements for us to have a functional health system. If we look at examples across Africa, broad-based taxes have been a fantastic way of raising revenue. If we look at Zimbabwe, they have a 5% tax on mobile money that they allocate for AIDS commodities. That's helped quite significantly. Gabon has implemented, as part of the health insurance reform, a portion of their mobile money. That also has been a massive boost to their diversifying their resources for the health insurance. One of the most famous ones actually is the PhilHealth, Philippines. They have a health insurance called PhilHealth, and they allocated the majority of their tobacco tax to help fund the National Health Insurance Scheme. And then, of course, on the continent, we have Ghana that has put a 2.5% VAT broad-based tax that helps fund 77% of their tax contribution to the National Health Insurance. And then, recently, President Mahama has been able to utilize this tax to expand it by uncapping it, and now this tax is being used to roll out MahamaCare. I think this is a fantastic example that the rest of Africa can use on how best we can use these broad-based taxes to support reforms in the health sector.